Prezydent Rzeczypospolitej Polskiej, pan Karol Nawrocki.
Due to the catastrophic situation in healthcare, Polish President Karol Nawrocki has convened a health summit to the rescue of healthcare. Today's meeting is an emergency meeting in a response to the deep crisis in healthcare. It is also a response to requests from the medical community for a meeting and discussion.
Nie można dopuścić do
We
sytuacji, w
cannot
której
allow a
dostęp do opieki
situation in which
zdrowotnej będzie
access to
zależny od miejsca
healthcare depends on
zamieszkania,
where you live,
od
how
zasobności
much money you
portfela
have,
i
and
od
luck.
szczęścia, proszę
Because
Państwa,
today in
bo
the
dzisiaj
healthcare
w
system in
systemie ochrony
Poland,
zdrowia
patients have to
pacjent
be
musi
very
mieć sporo
lucky.
szczęścia.
Jako prezydent Polski chcę wsłuchać się.
As President of Poland, I want to listen to your voices, hear what you have to say, determine whether the information that reaches the presidential palace is confirmed by your communities, and I want to create a scope of action for the Polish government. Health Minister Jolanta Sobierańska-Grenda was absent from the presidential summit. The ministry was represented by Deputy Health Minister Tomasz Maciejewski, who does not rule out a reduction in the number of hospital beds. I would not focus on the issue of wards, but rather on the number of hospital beds and their appropriate distribution in line with today's needs and transport capabilities. The summit brought together specialists from various fields and medical institutions across Poland. Everyone spoke about the need to take immediate action. There is never a good time for difficult decisions and reforms. Never. But paradoxically, a crisis may be a moment when it is a little easier to make such decisions and come to terms with them mentally. Healthcare workers are slowly leaving the medical field. Some of them want to work, but the Polish government is, for example, eliminating jobs. About 6 to 7 medical dispatch center managers have resigned in the last year because of problems in this area. Ladies and gentlemen, there are elements of national security at stake if we do not have enough staff in the dispatch centers. There are dispatch centers where we are short of half the staff every day. Queues to see specialists are a real threat to patients' lives, and there is a specter of them getting longer on the horizon. For example, the waiting time for a physical therapy consultation at an outpatient clinic is currently over 6 months. What does this mean from the point of view of physical therapy? It means that, for example, a patient who has undergone hip surgery or a patient who has back pain is forced to wait 8 months to see a physical therapist, and time is of the essence in physical therapy. Nurses and midwives strongly reject the ministry's idea of closing maternity wards and giving birth in emergency rooms. As the National Council of Nurses and Midwives, we do not agree with creating places in emergency rooms for childbirth. We know what the work in emergency rooms looks like at the moment, and it is absolutely not a place where a woman wants to give birth to a child, which is the most important moment in her life, for such a birth to take place in an emergency room. This is a step backwards for our country, setting us back several decades. It is unimaginable. The aim of the Presidential Health Summit was to present specific problems in the health service and to prescribe a remedy for the poor situation. Rescue today means that 2 things are happening simultaneously. We are talking about finding finances, regardless of where, but healthcare in this area is the most important. On the other hand, we are introducing and implementing specific measures, especially large ones, but also smaller ones. However, Polish Prime Minister Donald Tusk's government does not want to pay for healthcare. The government has prepared an amendment to the Medical Fund Act. Instead of going towards modern therapies, 4 billion zloty will go to the Polish National Health Fund to fill the budget gap. If I vetoed this decision, instead of 4 billion less, there would be over 7.5 billion zloty less for the treatment of patients. Faced with such solutions, due to what the government has done with public finances and healthcare finances, I am faced with such decisions as the President of Poland. This is moral blackmail against the president, because the government has taken patients as hostages. Karol Nawrocki signed the amendment, thanks to which the Ministry of Health will not be able to withdraw money from the medical fund in subsequent years. A patient service center will also be established to coordinate treatment and allow patients to make appointments with specialists. The president also emphasized that he will never agree to the privatization of public medical facilities, even in the face of the system's inefficiency. A few days ago, a document from the Minister of Health to the Minister of Finance was made public, in which budget cuts for healthcare and the introduction of limits on treatment and tests are planned.
System upada bardzo powoli.
The system is collapsing very slowly. Patients are being sent away, wards are being closed, hospitals are financially inefficient and are borrowing money from parabanks, for example, because we are also dealing with such hospitals, and this is a crisis that is a fact. Trade unionists are open to talk, but they warn that as a last resort, doctors will take to the streets. We as the medical community are ready for dialogue, but we are also ready to fight for our rights. The alternative to dialogue is the streets. Before the start of the Polish Health Summit, Polish President Karol Nawrocki appointed a health council composed of doctors and former health ministers.